So this is a short presentation on implementing large-scale fall prevention at U of R, um, and, and I'm Jeff Hauk. Stopping elderly accidents, deaths, and injuries, abbreviated as STEADY, is a CDC based intervention that has three core elements: screening, assessment, and intervention. And the algorithm looks like this, and so what we're going to do now is just dig into the algorithm a little. So essentially the goal is to categorize people as low, moderate, or high risk, and then with the moderate and the high risk people, see if we can do an intervention. And the intervention is going to be the Otago program, which has proven validity in some higher level studies. And there's this online certification that's available. This is from the website, and here's the link. So now we have a close-up of the screening and assessment process. So the first step is to screen, which will be done in the primary care setting with the promise and then the falls risk question. And assuming that people don't pass the screening or they're positive, then they would actually have to perform physical tests that check their balance and strength, that then confirm that they may benefit from something like the Otago program to decrease falls. And then if they also have a history of injurious falls or a number of falls, then they would be considered a higher risk, and then more than just the Otago might be necessary. So operationally at U of R, the proposal is that they would get the STEADY kind of falls risk question, and that's combined with a promise score, which triggers initiation to physical therapy, and then they get a call from physical therapy. Assuming that they accept an appointment, then they would come to physical therapy to have the physical assessments done, and then if they test positive on those physical assessments, then their risk is moderate or high, and essentially they might benefit from physical retraining like the Otago. If they're negative, well then their falls risk is for other reasons. So what are the physical tests that confirm the possibility of falls being related to either weakness or imbalance? The 30-second chair stand test, the timed up and go, and the 4-stage balance test. And the details are listed here and on the CDC website, which is listed here. Here's the thresholds for the three tests: the timed up and go. It's a greater than 12 seconds. Confirms their difficulty like maneuvering with balance and strength. The 4-stage balance test is really focused on balance, and especially standing or static balance, and so they need to pass stage 3. So if they pass stage 3, they're considered safe, which is tandem standing for 10 seconds. That's demonstrated here. And then if they're abnormal on the 30-second sit-to-stand test, which is more of like a lower extremity strength test, and here's the normal values from the CDC website. So if they were abnormal on any 3 of these, that would then confirm their possible contribution to falls. This is a sample of 120 patients that are participating in a community-based exercise program. And we have here is their number of patients who were fallers, what their tug scores were, 30-second sit-to-stand, 4-stage balance test, and then positive on any 3 of these tests, just to give you an idea of how many people might test positive on these different assessments. So the first kind of note is in this data set, the promise PF score or physical function score of 42 kind of demarcates people who would also be positive on these tests, and if you were to time them. So people of a 12-second or higher timed up and go score typically have a lower score than 42 on their promise physical function test. And similarly for sit-to-stand is abnormal, and they are unable to do a stage 2 or stage 3. And you can see here on any one of them, there's about 35% of the patients will test positive. So they're testing positive on different physical assessments. Now, the other piece here is of all of these fallers, so of 120 people, there were only 36% were fallers. Of those, only 42% had any one of these assessments as positive, meaning that their falls weren't all from weakness or imbalance, they're from other causes as well. So the goal is to classify people as moderate or high risk. So moderate risk would be that they answer yes to the fall risk question, okay, or they've fallen in the last year, and that they have positive assessments on the physical performance tests, but they haven't been injured. High risk would be they meet all of these criteria and that either one of the falls has contributed to an injury or they've fallen multiple times. That would put them, move them into the high risk category. The Otago program itself, just in brief, constitutes, you can select from 17 strength and balance exercises. And the idea is that there's like a 30-minute program that's coupled with walking for 30 minutes a day, and that these exercises then are done over an 8-week period. The follow-up by the PT is relatively low, like around 4 visits or so. And then it's also been coupled with monthly phone calls. A new paper in Physical Therapy Journal looks at the Otago program being delivered in the home or as a community-based kind of program. They both were found equally as effective, and this paper is rich in details on implementing the program, so I'd highly recommend seeking that out. The second piece that's in this paper that's, I think, critical for people implementing the program is that the tug scores over the Otago interval, which is that 8-week interval, changed somewhere in the range of 6 seconds at their highest. And then they had kind of 2 groups in the study. So one group changed from, on average, about 3 seconds, and another group around 7. And so that's the kind of improvement you could see, with the range being like either no improvement or up to 10 seconds. The 30-second chair stand reps were about 2, and that varied a little less, so you could have 0 to 3 in the one group and then 0 to 3 in the other. So you're basically able to change about 3 reps on the 30-second chair stand and up to 10 seconds on the tug scores. They also had a lot of perceived benefits in terms of walking, kneeling, getting up from a chair, climbing flights of stairs, and their confidence in not falling, which are all important. Overall, the Otago seems to decrease risk of falling by about 35%. So that's something that you might be able to communicate to the patients. There are other materials on the study site that there's something called a falls checklist that might be integrated into, like, looking at people who are trying to evaluate their home, or aren't going to improve from a physical standpoint, but might be able to reduce falls through the environment. In integrating fall prevention into practice, there's some best practices on there, and then talking about fall prevention with your patients, some ideas for language, and that's all on this link. So the overview is that patients will be screened in the primary care setting. They'll be then that'll be based on their fall risk question, their PROMIS score, and then they would need to get a physical assessment to confirm that part of their fall risk is from physical abilities, either strength or balance, using those tests, and then they would need to volunteer or agree to participate in the Otago prevention program. And part of that will be PROMIS assessments before and after the program, as well as the TUG 30-second sit-to-stand time and 4-stage. That's all for now. I just want to say I appreciate being included in this, and I hope to be a helpful resource in implementing this program.